I'm Natalie Kunzman, MD, and today we are talking about hair loss. Hair loss comes in many forms because of the many different contributions that are causing that hair loss. So we think of it in several different ways. We think of it sometimes as scarring versus non-scarring. Obviously, the scarring form is much more of a permanent type of hair loss. We can talk about it male versus female because the male pattern distribution of hair loss may sometimes differ than female related hair loss. We can also call it related to it being traumatic or non-traumatic. So let's go through some of the key causes of hair loss, and then we can dive into some of the treatment plans. So let's initially talk about some of the types of alopecia, which is hair loss. So we may have some that is related to scalp conditions, such as lichen planus or lichen planopilaris. So that ultimately is a scalp situation, and clearly the hair has to grow from that scalp. So if it is diseased or inflamed, it may not have healthy follicles. We also can have chemotherapy related hair loss, and chemotherapy will talk a little bit about the stages of hair growth, which is anagen, telogen, and catagen. And the telogen or rest phase can get affected in pregnant women would imagine this situation, that the hair is very lush and grows very well during pregnancy. And then after delivery of the baby, there is a massive shedding of all that hair that was in telogen phase that was arrested during the pregnancy. But that hair grows back. Then in chemotherapy, anagen is in its growth phase, and chemotherapy will go after those hair follicles that are in growth phase, and that is the hair that will shed and sometimes may come back or sometimes may come back differently depending upon that chemotherapy. We can also have traction-related alopecia, and some people may know this with some of the ethnic hairs that will put in a lot of extra hair, a lot of braids. The hair may be heavy. The style of the braiding will pull and tug on that scalp, and in that pulling and tugging on a consistent repetitive basis, we can get hair loss because of damage to that follicle. There is clearly hair loss that is related to breakage. So if the hair is dry or if it is overtreated with chemistry, some of the hair can absolutely just break off, but that may not be coming from the follicle area. We have hereditary hair loss and hereditary high hairlines that may be contributing to hair loss. Again, we can get back to some of the scalp inflammation, such as psoriasis and eczema and different seborrheic conditions. Then a very common area are those hair losses that are due to medications, which can contribute to that hair loss. We also can get hair loss related to nutritional deficiencies, such as your B vitamins and your biotin. Stress may be a contributor to this hair loss. And a very common one that I deal with on a daily basis in my office are hormone imbalances. A lot of people understand that estrogen, progesterone, and testosterone are hormones that can be out of balance, but also the thyroid, which is a hormone, can be off balance and cause a lot of hair loss at the follicular level or hair breakage or hair thinning. Don't forget, we can have other areas of hair that are at a loss, such as eyebrows and eyelashes. We can also have trauma-induced hair loss, such as those who may have had plastic surgery that were around the brow lifts or face lift scarring. And that can be playing a significant role to the hair loss. There is a classic age-related androgenic hair loss, and that goes back to the hormone imbalances. And for us women, as we are aging and our hormones decline, the testosterone that we normally make in the adrenal glands now has no competition from the estrogen and progesterone that our ovaries used to make. And in that regard, our hair structure may start appearing as though it is male patterned because of testosterone's influence. And at the scalp layer and at the skin level, we have dihydroxytestosterone, which winds up playing a role in this hormone loss and subsequent hair loss. So let's get into some of the treatment regimens. I will say it is certainly a challenge with some of the herbal remedies and scalp treatments as being somewhat inconsistent in their approach. So I will get back to the causes. Let's make sure our medicines aren't contributing. Let's make sure our hormones are balanced. So get your thyroid tested and get your thyroid optimized. For those who are experiencing the androgenic hair loss, and that may even come in the form of some endocrinologic disorders such as PCOS, also leading to that. And I do a lot of hormone balancing, and boy, does that make a difference with the hair texture and the hair growth to keep your estrogen and progesterone levels in balance. So we can do that with a bioidentical hormonal approach. So we want to avoid those medications. We want to optimize our hormone base. We certainly want to avoid any traction-related issues. We may or may not be able to affect chemotherapy-related disorders of hair growth, but we may look to some solutions after the chemotherapy has been finished. As a reminder, sometimes the proper way to stimulate some sections of alopecia or hair loss may actually be to put some cortisone on the scalp. Now, that can only be done for short periods of time, but it may absolutely rescue that hair follicle for a short period of time. So I would not be afraid if that is the solution that is suggested for your style of hair loss. There are a few ayurvedic approaches. There may be some traditional Chinese medicine approaches, and that is not certainly my expertise, but that may be something that may be part of your plan. Make sure you are nutritionally sound. And that does not mean being a carb junkie and eating sugars. It is optimizing your leafy greens to keep your B vitamins on board, in particular biotin, and making sure you have good fish oils to combat any inflammatory condition. Now, we have hair restoration experts, and they typically are plastic surgeons. So there may be styles and approaches that they have. Again, from the medical viewpoint, we have DHT blockers, and some of you men may realize that as far as your prostate medication, but even for you ladies, we may be able to use those medications to combat the effects of DHT at the scalp level. And of course, since energy medicine is some of my favorite medicine that is contributing, we now have some infrared light and caps that will infuse this light into the scalp, and it may actually rescue some of those follicles that are getting ready to be permanent and scarring. So we are finding that the hair follicle responds very nicely to red, near infrared lighting, and therefore there are scalp remedies to rectify this. Again, we just scratch the surface with hair loss, and sometimes it's an indication of your overall underlying health that can be corrected from the inside out. Take an integrative approach and take an active approach to your hair loss. Again, I'm Natalie Kunzman, MD. Until we meet again, be well